All right, this video is going to demonstrate the technique for applying a wound vac to a foot, and we're going to bridge the wound vac dressing proximally to the leg so that the track pad is going to be proximally placed on the leg. And with each of the sterilized kits, or the dressing kits that come with the wound vac, we have our granufoam, which is this black foam. We have the track pad, which is this piece right here, which connects to the hose, which is eventually going to connect to the pump. And then we have our draping, which is right here. Okay, so to begin this process, what I typically do, and we've outlined a wound on the dorsum of the foot, but again, we don't want to put the track pad right over the wound because there's bony prominences on the top of the foot, and the track pad, when the pressure is initiated, can cause some pressure injuries underlying that area. So we tend to track it proximally up to the leg. And what that also allows us to do is put the wound vac underneath a compression wrap that might be used for edema management in terms of venous stasis type issues. It also can be put underneath a cast if someone's in a total contact cast for offloading a diabetic foot ulceration. So there's a few rules and a few important things to consider when putting on a wound vac, and we're going to talk through the steps right now. So the first thing that I'm going to do is I'm going to cut our granufoam to an appropriate size so that we can track it proximally. And some of these are pre-cut so that you can just tear it apart. This one is not, so we're gonna have to cut it down to size. But I'm going to cut it so that we have this linear type piece. It's cut into a spiral, if you will, and it's gonna be cut long enough so that it can extend from the wound itself all the way proximally to where we're gonna track it up the leg where the track pad eventually is going to be placed, okay? Let's see if this is long enough here. Okay, so this first piece, we're gonna have a piece that's gonna go into the wound, proximal to the ankle, and then you can see that this piece is gonna be long enough where it's gonna be able to extend proximal to the ankle and overlying the muscle, overlying the tibialis anterior. So it's nice and soft and we won't have any risk of a pressure injury. So again, it's really important not to track right on top of a bone. If we were to put it right on top of the tibial crest, that track pad could then cause a pressure injury on the tibial crest, and that would create a complication. So we have this part ready. So we're gonna put this down for the moment. Second thing we have to do, and the second major rule here, is to make sure that the foam never touches skin, right? The foam is hydrophobic. It's going to be transferring exudate from the wound itself to the canister. And so if we have the granufoam sitting on skin that's not protected, that skin will for sure break down. So we need to be very cognizant to protect skin from any kind of damage. All right, so once again, make sure that this appropriately outlines the wound so that the wound is protected from the foam potentially traumatizing the skin. So again, we're going to do 1-2 blue. We're going to take off the one piece first, and this is going to window around the wound. All right. Once you get that first layer down, then you're going to hold on to the blue tab, and we're going to pull the number 2, right? And then we're going to take off the blue tab at the very end here. All right. And now we've got the wound windowed nicely, so it's going to be protected from the foam itself. So now we're going to put the foam in the wound and we're going to track this proximally. But the problem here now is all this skin proximal to the wound itself is not protected, and with this foam sitting on the skin, that skin is going to be damaged from exudate underneath the foam. So we're going to build a track, and we're going to track this proximally to where we want the track pad to sit. So I'm going to use my drape, and I'm going to cut my drape down, and we're going to cut a nice long piece that's going to be able to extend from where the drape ended, which is about here. I don't hopefully you can see it on a video, and we're going to bring it all the way proximal here. So again, 1-2 blue. I'm going to take off the one tab first. Okay, we'll lay that right over where the drape stopped previously. Okay, we'll gently place that down. All right, and we're going to take off the rest of the number 1 drape. Okay, and then with holding the blue tab, I'm going to pull this 2 next. Okay, and then I'm going to pull the blue tab. All right, So the next thing I'm going to do is I'm going to see if we are proximal enough. And again, I didn't get quite proximal enough, so I'm going to just cut a small piece just to be able to, again, extend that track proximally so that we can make sure that the skin is going to be protected. So let me cut one more small piece, and then we should be able to have it extend proximal enough. All right, so now we have a track protecting the skin that's going from the wound and then all the way up to the area where the track pad is going to sit. All right, so now if you're working on by yourself, you want to create a few shortcuts to help make your life easier. So what I would recommend doing is cut a few small strips. As you can see here, I'm just cutting a few strips, and this will help you to hold the wound vac to the leg. So let me show you what I mean by that. So I'm gonna put our foam over the wound, all right, and I'm gonna use this here to just hold it in place. Again, if you have an assistant, you can skip this step and move on to the next step, but this is gonna help us to, again, keep the granufoam in place as we are trying to prepare for the final step. So again, this is going to go proximal, so I'll hold that in place, and we are going to, again, lock this piece down so that we can move on. All right, so excellent. So now I'm going to just, again, do a double check. Distally, we got our granufoam in the wound. It's tracking proximal enough. It's tracking over muscle, not over bone. That's good. And everywhere underneath the black foam is protected with drape. So the skin is protected as well too. So now we have to create a closed environment, if you will. This is a closed system. So now we need to cover over the granufoam from distal to proximal. So we're going to cut a second piece here from our draping. And we're going to do, again, a 1-2 blue where we will cover over the granufoam. Take off the rest of the number 1 piece. We'll push this down. Again, hold the blue tab. Pull the number 2 next. And we'll pull the blue tab. But again, we can see here that obviously we didn't go proximal enough with that first piece, so we're going to get a second piece, cut another strip, and we should be able to extend this proximal enough to cover over the entirety of the granufoam. Again, 1-2 blue, we'll pull this off. Excellent. Okay, so now we are covered from distal to proximal. We've got a good, tight, closed seal, and now we're ready to apply our track pad. So the track pad has the track pad itself, and it has the hose that's going to eventually connect to the pump. All right. So before we put on the track pad, if we put it right on the draping here, it's not going to be able to pull any exudate through the granufoam and into the canister. So we need to cut a hole at the proximal part where the track pad is going to be placed. And it's ideal to cut a hole in the foam here about the size of a quarter or so. It doesn't have to be perfectly circular shaped, but the size of a quarter will allow the track pad to function at its optimal pull. So again, you can see underneath the track pad, there's a 1. So we're gonna pull that tab first, okay? And we have an option here. We can either place the hose proximally or we can place it distally. It's advised to place the hose proximally because, number 1, if the patient's ambulatory, it will be able to connect to the canister that's going to be around their waist. And also from a fall risk standpoint, we don't want that hose to be down or the patient's going to be at risk of tripping over that hose, and you're going to increase the patient's fall risk. So we're going to have this extend proximally, and I'm going to put the track pad over that circular shaped opening that I created, okay? And what I will do next is I'm going to then pull the number 2 tab, lie down the trackpad. And then we're going to pull this blue tab proximally here, and this will allow the trackpad to be in place. And this is the completion of the wound vac application. At this point, what we would do is we would connect our hose to the pump, and then we would initiate our negative pressure. The standard settings for negative pressure wound therapy is 125 millimeters of continuous pressure. That can be adjusted either increased or decreased depending on the clinical scenario or situation. And that's the extent of the application. The other thing to consider lastly is we have 3 types of foam that are available. We have the granufoam, or the black granufoam, which is what we used. This is hydrophobic. This is a very good conduit between the wound and the canister in terms of transitioning or transferring fluid from the wound itself to the canister. But this should not be placed over avascular tissue such as tendon, capsule, ligament, bone, hardware, because it'll dry out that tissue and it can damage that tissue. So if you have exposed tendon, bone, capsule, ligament, you should put some either a daptic or a contact dressing on top of that. The alternative is to using white foam. White foam is denser, but it's hydrophilic, so it retains moisture and it helps to protect that avascular tissue a little bit better. White foam can also be placed into tunnels if indicated. And then the last type is silver granufoam, which has silver built within the foam itself, which is an antimicrobial if that is indeed what you choose to utilize. I hope you learned something, and please let me know if you have any questions.